Welcome back to another episode of Breck's Blueprint. Today, I want to talk to you about a pretty important topic, P&L statements. So P&L is profit and loss. It's exactly what it sounds like. It's how much money you bring in, your profit, minus your losses, all of your expenses. And it sounds kind of simple, but most people don't understand, how much money they're bringing in, where it's coming from, and even more importantly, where's their money going? Like, what is their biggest line item on their P&L statement? And so this is good for any business, but specifically geared towards med spas today. And I'm going to share some knowledge that a previous boss of mine shared probably like 10 o'clock at night, one night, trying to explain what cost of goods meant to me. So we're going to start with the biggest line item typically on a med spa's P&L. The biggest expense is always cost of goods sold. So that's what COGS stands for. COGS is cost of goods sold. I've spent a ton of time talking to pharmacies and getting volume discounts and trying to bring all of our numbers down. And cost of goods is still well over 50% on our P&L. So it is a huge cost. There will be no other line item that is more than that. Like Botox is expensive, semaglutide is expensive. So that's going to be probably the number one item that you need to pay attention to. Call the pharmacies, talk to your rep, see if there's anything that you can do to get a negotiated rate or to get a discount, and anything that you can do to try to bring your costs down, especially your Allergan, Galderma, Mertz reps. See if you can get some sample product or some training product or whatever you can accomplish. Your reps have a quota that they need to meet every quarter too. So be nice to them. Like if they need to hit a sales quota, ask them, say, how can I help you? And it's a symbiotic relationship at that point. So really, really, really focus on your cost of goods. Another line item that is really big for larger med spas and corporations is labor, right? So you'll want to structure your employees if you have them in a specific way to where as they bring in more money for you, they make more money and you take care of them, right? So there's lots of different ways to structure your employees and your labor costs. So you can have W-2 employees where you're paying Social Security, Medicare, all of that, health benefits, 401k. And then you could just have 1099 employees where they are outside contractors, essentially. So make sure that your outside contractors have an LLC or a corporation set up so that they can flow all of their tax dollars through there and you can pay their business. There's lots of different things that you can write off on your taxes compliantly and legally, and that's a whole nother call in and of itself. So we're not going to get into taxes today, but look into labor as well. Another big line item for us is insurance and not just malpractice. I mean, malpractice is a huge topic. We had a whole call just about that. I think I told you guys that I use CM&F because they cover in all 50 states. They are one of the very few malpractices that will cover um, peptides. So that's kind of the new thing out there. You want to make sure that you are covered for that. I do a 1 million, $6 million occurrence policy for everybody on my team. I pay for it. It's a part of their benefit. And that way I know when it's expiring and I know they never lapse. They're good to go. And when it's an occurrence policy, you have that policy forever. It's not just claims made and you're covered for the amount of time that you're insured with that company. So that is going to be a big cost. 1 million, 6 million occurrence policy is going to be quite a bit more than a 1 million, 3 million claims made policy. I personally want to make sure that I'm overinsured instead of underinsured, but that's something that you're going to have to decide on. Typically, when you do your malpractice, you're going to be able to add your general liability on there as well. So make sure that you're covered. Your general liability is covered for your clinic in case somebody falls. You'll also want to make sure that you have added like designated insurance for your medical director. That's a big one. Medical director coverage is usually easily added onto your policy as well. And you can add an additional insured on there. So I always make sure that my medical director is listed and the business is listed under everybody's own personal malpractice policy. You can also have a group policy. I don't want my practitioners all sharing a policy. So it doesn't really save any money either. That's why we have everything together. So insurance is when you add it all up and you make sure that you're doing everything right, it will be a pretty big line item on your P&L. And then next is advertising. This can be huge for some med spas. It can be nothing for some med spas, but it is something that you need to research. We started with Google AdWords, and we were having difficulty tracking anybody that came out of that. And the conversions, we're still working on getting that cleaned up, but you're renting space that way, essentially. We're doing meta ads as well. We've tried Yelp. I think AI, Chat GPT, Claude, those are going to be huge undertapped markets that you'll want to look at. But all of this costs money, right? And so a couple ways that you can keep your P&L line item of advertising down is post on social media for free. Get Instagram, get Facebook, get TikTok. You're going to need to appeal to all age groups, right? So get good content to post on all of those platforms and make sure that you are responding to comments and that you're staying active on there because that's going to help. Also, Google reviews are still huge. Make sure you have a Google business profile. Like anything that you can do to try to not rent space with advertising, but actually improve your SEO or your search engine optimization is very helpful. One thing that we just started doing in the last year or so was we started a blog and a YouTube channel as well as this podcast. Anything that you can do to get good, strong backlinks to your website and to your Google business profile is going to be extremely helpful. Those are ways to try to keep those line items down. We're probably going to have another call about each of those topics individually, but I wanted to just give you guys a quick rundown of the biggest items that are typically seen on a med spa's P&L and a few tips to get those down. Please tune in, like and share some of our content. We would greatly appreciate it.